Keystone Medical Services, part of Hospice of Holland, offers palliative care to providers and their patients. Medical Director Tod Wyn highlights this relatively new service.
Palliative care is for patients who still may have similar disease processes. So these are patients who may have cancer, heart and lung disease, renal disease, people with various neurological progressive diseases, but for people who are not in their last 6 months or so of life. And these are patients who may actually still be looking at curative potential. They may be dealing with cancer-related pain. They may be dealing with shortness of breath. They may be dealing with nausea, vomiting, agitation, or simply need more supportive care as they recognize that they have a progressive disease where they need to do some advanced care planning. And patients often have a lot of questions or misconceptions about what palliative care is. They'll get it confused with hospice, or it'll simply be a new and confusing word for them. The first clinical experience that the patient will have with our program is with a face-to-face visit with one of the providers. And there are 2 physicians and 3 nurse practitioners. And we often end up going to their homes. So we'll see patients in their homes. We'll see them at assisted living centers or in long-term care facilities. We'll get an understanding of kind of what the potential need is, how we can help to address that, and then get things started with our program. For instance, a patient who has COPD and gets these exacerbations of shortness of breath, you know, their benefit of going into the hospital isn't very high. Their lungs are really not going to get fixed. The trajectory of their disease doesn't change. And the interventions that can be done in the hospital are actually many of those interventions that can be done at home. Our goal in a patient like that is to really try to have as much optimal care at home so that patients don't have to go to the hospital for something like a shortness of breath exacerbation, that kind of thing. Palliative care functions entirely as a consultant service. So we are not taking over primary care duties or oncology duties. We still ask and expect that there's going to be a quarterback of this team who may be the oncologist, may be that primary care physician, and the palliative care team is there to help to support that. So this is a multidisciplinary team. So there's a provider, either a physician or a nurse practitioner. We have our palliative care nurses, and they really do a lot of the support and care for our patients. And patients, of course, can call in at any time to get questions answered or to ask for other services or prescription refills, those kinds of things. But we will have our nurses calling patients intentionally on a regular basis to hear how they're doing. We also have spiritual care. We have chaplains who are available to go and see patients. We have a strong social work component to all of this, which is necessary in a palliative care program because you want to be answering things like making sure they have a DPOA and making sure that they have some advanced care planning in place for people. On occasion, we've even had requests to use our nutritionist, our dietitian, and we've been able to make that person available. So it's really the idea is having a very strong team approach to the care of these patients. A key part of this program is making sure that we have good communication. I need to know what the other providers are doing, and they need to know what I'm doing. So typically, when we see a patient, we enter a note into our electronic medical record, typically the same day, and that note is also then faxed to the primary care physician and the oncologist and whoever else is involved in that patient's care. We work a lot with home health agencies because they may be involved with some of these patients as well, and we want to make sure they understand if we're starting a new medication or if we're recommending some sort of other treatment, that they are aware of that, and so we want to have good communication with them. We have, I think, some wonderful providers, some wonderful nurses, and I hear frequently from our patients and from our referral sources that this has been a great benefit for them. Yeah, the process of making a referral is quite simple. They simply pick up a phone and call, and they'll speak to usually our admitting nurse, Jill, who will take the information down and start the whole process of contacting the patient and making an appointment. Anybody can make that phone call, a family member, certainly any medical staff that are involved with the patient. We do ask that we have an order from either the primary care physician or the oncologist to actually go ahead and see the patient, because we're working in concert with those physicians, and we want to make sure that they're okay with us being involved. So we will take care of that. We'll contact the office and ask for the order, but any person can actually go ahead and make the referral.
To learn more about Keystone Medical Services, call today or visit keystonemedical.org.